Hi everyone, we are Ngoc Son and Thu Hang Dinh. Today on behalf of my college, I'm here to talk to you about our research paper on cultural issues in public health crisis communication, an examination of cultural determinants in the COVID-19 pandemic in Vietnam. Our presentation has 8 sections as on the screen. Now I would like to tell you about the reason why we choose to study this topic. Until 15 September 2020, Vietnam reported 1,040 cases with 27 deaths, which is considered as one of the nations having lowest cases and deaths in the world. Vietnam's success in controlling the COVID-19 pandemic has made an impression and brings a lot of useful experience from many countries. Several primary factors has been characterized as contribution for this early achievement, such as a well-developed public health system, a powerful central government, and a proactive containment strategies based on comprehensive testing, tracing, and quarantining are contributed to this early success. However, there are not many scientists concerned about cultural aspects of the pandemic still now. Lessons from Vietnam's success in utilizing the advantages of its cultural characteristics can be worth examining in detail and so that other countries may consider their responses to pandemics. This study aims to present a systematic review of cultural aspects concerning a question: what is cultural factors influence the effectiveness of Vietnamese government response in containing COVID-19. Having the distinct perception of crisis could be considered as the first cultural determinant. In the traditional Vietnamese view of the world, yin and yang play the role in a proper balance. Crisis happens when yin and yang are unbalanced, so maintaining the harmony is the key rule to prevent the crisis. In the research of hostage, Vietnam is considered as a long-term orientation culture. It means that Vietnamese people think more about the future rather than here and now. So this cultural characteristics also has been applied in constructing a public health system. In Vietnam, each province has its center for disease controls. Moreover, Vietnam established an electronic communicable disease reporting system which gathers data regularly from all provinces for the purpose of biosurveillance, including early warning and respond effectively. In the field of crisis communication, most of the research is based on the classic definitions of crisis by Herman 1963, who characterized crisis as a negative event. In Chinese, crisis was refer to the meaning of both dangers and opportunities. However, Lê found that Vietnamese people think crisis has both negative and positive denotations. They are intertwisted each other. The people in this country consider that most of the possibilities in their life circle are related to uncertainties and crises, recognizing that uncertainties are unavoidable fact. Instead of surrounding to misfortune and natural forces, the Vietnamese people always active prevent crisis to get benefits from the calamitous occurrences. The next cultural determinant that contributed to the success of Vietnam in containing COVID-19 is the prior experiences in managing crisis. According to Wood 1995 and Grunick et al. 2002, the more crisis an organization experienced, the more tendency it has written crisis communications plans, better prepared and equipped, the stronger PR expertise. So the above arguments are in full compliance with the Vietnamese context. Vietnam has a long history of fighting continuously against foreign invaders. During its thousands of years of existence, the country has to fight with most of the great empires in the world, such as China, Mongolia, Japan, France, and America. In addition, with its geographical position located in the tropics, Vietnam often faces a natural disaster, especially storm and floods. Furthermore, Vietnam has been affected by outbreaks in the past. The country experiences SARS in 2003, swine flu in 2009. Therefore, Vietnam government and its citizens has both experiences and infrastructures to take appropriate actions, from preparing to control the outbreak. The next cultural determinants of our study is China literacy. Understanding deeply Chinese political culture is the key point of success of Vietnam in controlling COVID-19. In reality, Vietnam and China are not only sharing the common borders but also sharing a common political ideologies as one-party communist governments with market-oriented economies. So they can understand well the thinking of the Chinese counterpart. In history, Vietnam has also learned a great lesson on how China underreported the public health crisis. The lesson here is Vietnamese government did not immediately believe in statements from Chinese governments, especially when they published the so-called official numbers. In reality, the Chinese government said everything is under control and the pandemic is not really a matter. And then the Vietnamese government prepared for the worst scenarios and closed the shared borders. So understanding Chinese political characteristics is one of the key reasons make Vietnamese governments can quickly examine situation and have appropriate policy response to cope with the pandemics. Wearing face masks in public place is considered to be one of the most effective measures to reduce the spread of COVID-19 and one of the factors to help Vietnam to prevent the transmission of the pandemics. According to surveys with more than 2,000 participants from March to April 2020, 99.5% of respondents said that they are using a face covering when going out. Moreover, Vietnam is located in a tropical region with strong UV radiation, so protecting the beauty, prevent the skin from ultraviolet rays are the habitual demand. Moreover, the desire to have white skin is a specific standard of beauty among Vietnamese people. In addition, Vietnamese people use face masks to protect their health from dust and inhaling fumes from motorbikes and populated environment. Hence, the Vietnamese government has no problem to convincing pupils to wear a face mask in public place to limit the spread of pandemic COVID-19. Strong collective cultural and concentrated political power are considered key factors that empowers Vietnam's success by evoking community spirit. The Vietnamese government has built up the image of coronavirus as a key enemy and appeals to the national solidarity to combat it. One of the methods that Vietnamese leadership used in using war rhetoric regarding the COVID-19 to engage its citizens to unite all people against the virus. The tactic is used to intensify solidarity and broad consensus among Vietnamese people on this crisis. Vietnamese media concentrate on the prominent narratives of its citizens as soldiers in the war against COVID-19. Similarly, Vietnamese government successfully applied the mobilization of nationalism and heroism during the battle with COVID-19. State media brought up story about heroes, sacrifice, and resilience that rose the nationalist narratives to support the government. Coronavirus has imposed the emergence of new type of heroic figures. Healthcare workers were perceived as frontline heroes and white blue soldiers. Image of military soldiers who turned their accommodation to be admirals' quarantine camps were widely shared on social network. The state authority and local media used the phrase "the war against COVID-19" to portray the efforts and sacrifice needed to adverse the pandemic. Many slogans such as "Love our country, love our people," "Stay where you are," or "Solidarity is the power to fight against COVID-19" has appeared regularly in newspaper and social network sites. By creating public health messages that culturally suited to each group of people, the Vietnamese government approaches its people effectively during the time of combating COVID-19. Vietnamese authority and its governmental communication system provided a clear message about the seriousness of the new coronavirus when it only started appearing in China. Media system during this time also have more freedom to report all COVID-19 related updates. Social media platforms were utilized to connecting citizens to the officials and closely monitoring and detecting suspect patients. Especially, there are many creative communication messages were created to attract people easily, warning about the seriousness of the novel coronavirus and following the guidance of authorities. For example, in February, an ear-catching song named Gen-Covid was released by Vietnamese Health Ministry. This comical public health promoting video went viral and spread preventative advice over global social media. So, for what happened in Vietnam, we can see cultural determinants played vital roles in handling crises. By taking advantages of each culture, Vietnam has initial important success in controlling the COVID-19 pandemic, and Vietnam's success can provide value lesson for other countries in fighting COVID-19. So, thank you so much for your attention. Your questions are welcome.